Now, it's taken years of campaigning, but today MPs will debate the new bill to legalise assisted dying in England and Wales. It has, of course, divided opinion. But let's talk now to one of the leading lights in the campaign for assisted dying, the broadcaster Dame Esther Rantzen. She joins us now on the phone. Dame Esther, thanks so much for talking to us this morning. We really appreciate it. I just wonder how you're feeling ahead of today's vote. Just how important a day do you believe this to be?
Well, I think it's very important indeed. Not for me personally, although I have got stage 4 cancer. It's still going to take 2 years before the law changes, if it changes, to allow assisted dying. And I don't think I've got 2 years in me. So if I want assisted death, which I do because I want to have the choice, I will have to go to Switzerland, to Dignitas in Zurich, to achieve that. And I'm fortunate because I can afford to go there. It will cost, I predict, something like £15,000. I can afford that. But for all the hundreds of thousands of people in the future who can't afford that and who want to die in their own home, surrounded by people they love, if the symptoms get really rough, as they sometimes do, and palliative care can't help, which is sometimes the case, they will have the choice if this law is changed, and that will be a very good change, in my view.
Some have credited you with triggering a national debate on the issue of assisted dying, and they say that that's what's led to this vote. How do you feel about that? And did you think that you would see this happening so soon?
Well, no, I certainly didn't predict that I would be around to hear the debate, as I will today. I'll be glued to my television. My health doesn't allow me to attend the debate, sadly, but my daughter will be in the public gallery and I'll be sitting by my television watching. I think timing is important, isn't it? And Dame Diana Rigg made her views clear when she was dying, and so did the sculptor Nicholas Dimbleby when he was dying. And I think a number of voices of people that have some sort of influence had already happened. And when I happened to mention that I put my name down for Dignitas because the law is such a cruel mess in England and Wales at the moment. Scotland is about to change theirs. Jersey is about to change theirs. The Isle of Man is about to change theirs. So England and Wales are behind in this process. But maybe my mention of going to Dignitas did cause others to feel very strongly that it was time for a change here.
There are many who still have deep concerns, as you'll know, about a change in the law. Kim Leadbeater, who's putting forward this private member's bill, says that the safeguards would make it the strictest set of rules in the world, but some are still worried that some vulnerable people could be put under pressure to end their own lives. They worry about the risk of coercive control, for example, which can be hard to detect. What would you say to them?
Well, at the moment, there's no precautions against that causing people to take their own lives. I mean, this is the only occasion when doctors and a High Court judge are being asked to make sure that there isn't coercion. I think for some people, no precautions would be tight enough because their conscience or their religious faith or some view of theirs makes them feel that only God has the right to decide when someone should die. But for those of us who don't share that view and who want personal choice in this, as we do about who we marry, which maybe we didn't have in the olden times, or whether we can have children, which certainly we used not to have, I think personal choice is important, and I think that should be taken into consideration as a priority when it comes to death.
And the law would only apply to adults who are terminally ill and have just 6 months to live. But 6-month diagnoses can be hard to make, can't they? And some people outlive doctors' predictions by some years. They can go from the point of real despair to a much more optimistic state. Do you consider that to be an issue?
No, because we will have the choice. So if they don't want an assisted death, they don't have to have one, even if they have previously asked 2 doctors and a judge to rule that they are not being coerced, that it is their free choice. They can exercise that choice. Nothing says that, for example, if I qualified, which as I've explained, I don't think I will, nothing will make me ask for help to die unless that's what I genuinely want, unless it is my choice. No pressure either way.
And what about this other issue, this other area of concern, that this could be the thin end of the wedge, or to use another analogy that's used a lot around this debate, the slippery slope, that this tightly controlled legislation could be loosened over time to include more people?
Well, Kim Leadbeater has made the point that this is a bill that only applies to terminally ill adults in the last 6 months of their life. So it cannot be extended to any other category. And what evidence from abroad has shown is that there is no slippery slope. Other countries have applied different criteria, wider criteria in some cases. But we're modelling our law on Oregon, and Oregon has remained in place for well over 20 years. So the slippery slope argument, which is often used by people who don't like any law to change, in this case is not applicable.
And I need to let you go in a moment, Dame Esther, but before you go, I just wondered how you're doing. How are you?
Well, I'm between scans, so time will tell. My next scan is after Christmas, and we will see. And if it shows that my cancer is spreading again and the miracle drug I'm on is not working, well, then I'll have to proceed with my decision to go to Switzerland. But let's hope, fingers crossed today that the vote will go in favour of choice. Fingers crossed after Christmas that the scan will show the drug is still working. Let's hope so.
Well, we wish you all the best with those scans. Dame Esther Rantzen, we really appreciate you chatting to us this morning on this big day of the vote. Thanks very much indeed.
Thank you.